This is Radio Now 95.3 FM. Come for the news, stay for informed conversations.
This morning on The Newsmaker, the federal government has taken another step in its efforts to address the Japa syndrome that has bedeviled the healthcare industry. The latest step has been a ban placed on healthcare professionals applying for a leave of absence to go job hunting abroad. This new directive is also followed by announcements by the federal government that they have hired some 120,000 nurses as against the previous number that stood at 28,000. Another problem bedeviling the medical and healthcare industry in Nigeria has been the issue of remuneration, an issue that the federal government has attempted to address in previous meetings with the Nigerian Medical Association. Joining us this morning to speak on these issues as well as what efforts the government has been making and indeed the efforts of the state governments as far as medical doctors and healthcare professionals are concerned is the Kaduna State Chairman of the Nigerian Medical Association, Dr. Sheyi Madaki. Dr. Madaki, good morning and thank you for joining us on the conversation.
Good morning. Thank you for having me.
Dr. Madaki, what is your response to the federal government's placing of a ban on medical and healthcare professionals seeking a leave of absence to go abroad?
All right. Thank you. I was taken aback by that directive first and foremost because you need to first understand what the leave of absence is. And the public service rules is who should go for a leave of absence, under what circumstances. So I feel it shouldn't even be an issue in the first place on making a pronouncement in it because the law is clear. I mean, who and who should benefit on that or should be given a leave of absence is clearly stated in public service rules. So, having sure what we should be doing is to actually ensure that is applied and is followed to the latter.
Can you share with us what those details are?
Well, first, before I do that, I wanted to just state, because for the whole public service, whether doctors, healthcare workers, other nurses, we're all under the public service. And those rules apply to each and every one of us as public servants. So if you are singling out healthcare workers to say that you are placing a ban, so it means that whether you qualify to go for a leave of absence or not, you're going to be targeted. Even if you're seeking to go for the right reasons, people go for different reasons. Okay, but to generalize and start preempting that those healthcare workers are going on the basis of going to seek other jobs, I take an exception to that narrative. So a leave of absence, somebody can take a leave of absence to go to go for further studies. You can take a leave of absence to go and, it's clearly stated there.
So you're essentially pointing out that the government does not necessarily have a way of knowing who is going on that leave of absence for the sake of looking for a job elsewhere.
Exactly. You can't, people do that for different reasons. One of the things you need to do is to actually ascertain. If you already know that somebody is taking a leave of absence to go look for a job, the rules, the law does not allow that. I mean, if you go to look for a job somewhere else and you are employed in the public service in the country here, then the law clearly states that such cannot be granted. You either resign or you go for the right reasons. So,
Dr. Madaki,
I think we're just missing the point in trying to just round things that should clearly be followed in terms of the rules.
Dr. Madaki, speaking of the rules, how long is a typical leave of absence for anybody who qualifies in the medical in the healthcare industry?
No, it's not different from any other public servant.
Okay,
as it is. So I said, depending on what the reasons are, you could take for medical reasons. You could go to seek, you could go on medical grounds. You could go on study leave. Okay.
Right. So, Dr. Madaki, if the federal government was able to identify those who take a leave of absence so that they can go seek for a job abroad, would you support this particular ban?
Well, already have faulted the reason for actually even coming up with a ban in the first place. If we actually understand how the leave of absence works, we don't even need to make a pronouncement on this. The institutions where these health workers are said to have taken leave of absence to go and then get jobs and be there, then it means that there must be a collusion at the level of the institutions. Because if, as a chief medical director, for instance, or a hospital administrator, you understand that somebody has taken a leave of absence and he has declared that he's going to look for greener pastures or look for a job out there. I mean, it doesn't make sense. You would not approve such. So how do they get the approval in the first place to go on that leave of absence if you know ab initio they're going to look for another or take up other jobs in the other countries?
Dr. Madaki, let's expand the conversation a little more. I mean, in the end, we know that these moves that government has been taking has typically been to stem the brain drain that we've been having in the sector, losing a lot of healthcare professionals to countries such as the United Kingdom, for instance. I wonder if the Medical and Dental Council were to adopt a policy similar to, if you remember, I think this was early last month or January, when the Nurses and Midwifery Council of Nigeria instituted new policies that require nurses to have practiced for, I think, up to 2 years before they're able to get their certificate, which is something that would be needed to get a job outside the country in the first place. If we were to see the Medical and Dental Council approach it in a similar manner, what would your stance be as the medical association in the country?
Okay, thank you. You see, this issue of brain drain, we need to really understand what exactly are the causative factors, the underlying factors, to be able to even address it holistically. I see what we're doing is just trying to just go around the issue and not really hitting the head. So first of all, talking about what cadre of healthcare workers are we losing? I'll give an analogy. If you have a leaking bucket, for instance, and you're trying to get water in it to fill the bucket, if the bucket has a big hole in it, no matter how you run the tap, I mean, whether you run it faster, that bucket will never be filled. So as you're producing, as the water is trying to fill up, it's also draining out. That's exactly what is happening. So one of the things we need to just focus on is really look at these factors that are actually making these health workers to move out. And to be honest, this has not quite been addressed. We've just been scratching the surface and trying to go around it. Okay, so now, let's take, for instance, you now ban or you restrict people from moving till 2 years after. Are we now saying that after 2 years, you are now free to go? And then, these are not even the cadre. This is not the skill mix of people that we're actually losing much. Yeah, I know the younger ones are going, and it's creating a lot of gaps. But I tell you that we are having specialists even moving in their droves. There are people that have practiced for over 10 years, 15 years, and they're still contemplating moving out of the country because of the harsh situations that they're facing, the tough conditions they're having to face, the poor remuneration that we're talking about. These things have not been addressed. So these are factors. What are these factors that are pushing these people out of the system and making them consider? The push factors are the ones that we should focus on, not the pull factors. The pull factors are the ones that the conditions over there that are making them to actually look out there. But that is not even as important as the push factors that we have here. These push factors you talk about remuneration, for instance. You talk about the environment, the working environment, the equipment, the training. How is it done? I'll tell you something. Some 10, 15 years ago, the residency training, we had a lot of people willing to go into residency training. I mean, and the whole system was so jam-packed that people were scrambling to get admitted into the residency program. But what do we have now? We have a depleted workforce such that we are begging doctors to actually up residency programs. A lot of teaching hospitals have lost residents to brain drain. And then the few that are even here are not even willing to go into the residency because they feel, well, why do I kill myself? Why do I just go and suffer in harsh conditions? At the end of the day, nobody appreciates, nobody is even giving you, the attention you really need. So it's about valuing our own, and which we are not doing.
Dr. Madaki, let's bring this a little closer to home, because every time we talk about these issues, we focus on the federal government. At the subnational level, say the state level, for instance, what sort of conditions are available for doctors and healthcare professionals? Are they comparable to what is available at the national level?
Wow, at the state and local government level, I'll tell you something, Steve. It's worse, far worse than what's happening at the federal level. I'll tell you something. The brain drain we're seeing, we have even looked at it such that we're having the external brain drain and the internal brain drain. The external being the ones that the doctors are moving out of the country. The internal brain drain that we're seeing is now the ones that doctors are moving from the state to the federal, because the federal has a bit of better conditions than the state. Although it's not in all the states. There are a few states that are doing good. I mean, they're doing comparable to what the federal are doing. But there are some states are doing horrible, abysmal. I mean, the conditions of doctors at state level, you're still talking about even some states yet to implement the 2014 COMMES salary scale. And we're in 2023. And there's a revised salary scale for doctors at the federal level. So many times these salaries have been revised, but some of the states have not even, are still far away, talking about salaries that have not been reviewed in 10, 15 years.
So, Dr. Madaki,
yes.
Beyond, or rather, beg your pardon, if these reviews that have been agreed on are implemented, will that stop the brain drain, or is there anything else that we can start doing to reverse the numbers that we are seeing leaving Nigeria?
Yes, I'll tell you something. If government is sincere, you reach an agreement, you implement that, you do those things that have been tabled. We've signed several MOUs, agreements that were never honored. And then doctors are beginning to lose confidence that, okay, there is no willingness to actually do these things that were identified as causative factors. But if these things are done and they are done timely, sincerely, implemented and followed through, I tell you what, we are going to retain the ones we have. And in fact, we're going to reverse the trend. Some will be willing to come back. I tell you, many didn't want to go, but because after, some doctors have, because of the conditions they've gone through, some have gone into depression, some are not just happy working because of the harsh working environment. Things are addressed squarely. I think, and I believe, and I know that, of course, we can have some respite. Because we've always been crying that if nothing is done, there is this risk that in years to come, we may not even be able to attend to even simple health conditions that will present in hospitals, because we have no doctors. And that has left a lot of space for those who are not even qualified to enter the system. We're seeing a lot of quackery, because where there's a gap, something must fill it.
I was coming to the Minister of Health, right? He was recently on television where he said that, look, we currently have about 56 or 55,000 registered medical doctors in the country. And he says of that figure, within the last 5 years or so, we've lost about 15 to 16,000 doctors. But in the same period, we have trained 17,000 doctors. So in some ways, it seems like we're only just able to meet up with what we're losing in the first place. We're not necessarily increasing at an exponential level. Speak to us on your stance as the chairperson of your association, your stance on how this administration is approaching health as being central to social welfare across the country.
Yes, so thank you very much for that question. One thing we need to know is, first and foremost, we're actually not producing enough. And then in the few we've been able to produce, we're actually even losing them in more faster rates than at the rates at which we're even producing. So if nothing is done, you see that if this trend continues over some time, you're likely going to be faced with a lot of challenges, and then when you talk about the doctors that we have currently, it's one thing to have the number of registered doctors that you mentioned in the country, and then it's another thing to actually know whether they are even whether they're actually practicing in the hospitals or they're in other sectors within the health system. So the skill mix is another issue entirely. How do we get the right skill mix? How do we get the specialists? Because you find some specialties that are really rare in the country, and they are really in demand if you go out there. Because the minister mentioned that brain drain is not just peculiar with Nigeria, it's a global thing. And there's a competition among countries to get the best. And if we are unable to create the right atmosphere and the right conditions for the ones we are producing, we end up losing them to other clients that have ready and better systems to absorb them and give them, the things that they want. So yes, there's a part where you talk about patriotism, and there's a part where you talk about the functionality of the system, and then the sincerity of purpose and other things, and even talk about corruption in the system. We've had instances where doctors have come into, whether it's the state employed or some in the federal employed, that you absorb, you're employed, and for 3, 4, 5, 6 months, you've not started receiving any salary. You wait, you have to keep, following up. How does such person focus and do what is employed to do?
Well, Dr.
These are things that can distract. Yes,
definitely. That question is a good place for us to pause the conversation as far as this is concerned. Thank you very much for speaking with us on the Newsmaker this week.
Thank you, Steve.
Lagos, Nigeria. Our guest on the conversation is Dr. Seyi Madaki, the Kaduna State Chairman of the Nigerian Medical Association, and he joined us to speak on the federal government's latest efforts at stopping the brain drain that has affected the healthcare industry. This effort is the prohibition of workers in the healthcare industry from leaving Nigeria on a leave of absence without first resigning their appointments. The conversation continues on Now Breakfast as we turn next to Community Watch right here on your Beyond the News station.
This is Radio Now 95.3 FM. Come for the news, stay for informed conversations.